Hi, my name's Callie, and I'm going to be your student nurse today. I'm going to go ahead and start off by checking your ID band. Can you just tell me your name and date of birth, please?
Francisca Zwicker, 2599.
Okay, perfect. I'm going to go ahead and start you off by draping you. Are you comfortable?
Yes.
Okay, perfect. So today we're just going to go through a quick musculoskeletal exam. It should take about 25 minutes. If you have any questions at all, just let me know. Everything that's said today will be kept between us. Do you have any questions before we get started?
No.
Okay, perfect. So I'm just going to start off by having you swing your legs to the side and just move your hair out of the way, please. So I'm just going to generally inspect your cervical spine and your paraspinal muscles. So I see that the color is even throughout. I see that you're symmetrical. I see no rashes or lesions. I see no edema. I'm going to go ahead and palpate. If you have any pain or tenderness, just let me know, okay? Any pain or tenderness with any of that?
No.
Okay, perfect. So I didn't feel any edema and I didn't feel any masses. And then I'm going to go ahead and have you swing your legs back around here. So we're going to do range of motion of your head and neck. And so if you can just put your chin to your chest for me. Perfect. And then point your head up to the sky for hyperextension. And then left and right. Now try to bring your ear to your shoulder without bringing your shoulder up to your ear. On the other side too. Perfect. So you have active range of motion of your head and neck. I'm going to go on to inspect your temporal mandibular joint. So looking at your face, I don't see any bulging. Your face looks symmetrical bilaterally. I'm going to go ahead and palpate. If you have any pain or tenderness, let me know. But just open and close your jaw when you feel my hands, okay? Okay, perfect. So that feels strong. I feel no abnormal clicking or popping while I do that. I'm going to go and inspect your supraclavicular joint. So I see that it looks symmetrical. There are no rashes or lesions, colors even throughout. I don't see any masses or edema. I'm going to palpate. Let me know if you have any pain or tenderness at all. Perfect. I didn't feel any edema or masses with that. So now I'm just going to go ahead and inspect your shoulders, arms, elbows, wrists, hands, and fingers. So I see that they are the same size and color bilaterally. There are no rashes or lesions, masses, nodules, skin breakdown. I see that they look symmetrical. I'm going to go ahead and palpate. Let me know if you have any pain or tenderness when I do that. Pain or tenderness at all?
Yeah.
Okay, and I didn't feel any edema or masses while I did that. So we're going to go ahead and go into range of motion of your shoulders. So if you can just extend them down normally to your side, hyperextend them back, flex them up to the sky. Now if you can internally rotate them like you're getting arrested and externally like a field goal. Now if you can abduct them away from the body and adduct them across the midline. Perfect. So now I'm going to go ahead and do all of those with resistance, okay? So extend them normally. Okay, don't let me push it forward. Hyperextend it back. Don't let me push it forward. Flex up to the sky. Don't let me push it down. Okay, now if you can go ahead and internally rotate like you're getting arrested. Don't let me bring it forward. And externally rotate. Don't let me bring it down. Abduct away from the body. Let me push it forward. And adduct across the midline. Don't let me bring it out. Okay, I'm going to go onto this side. So if you can just extend normally for me. Okay, don't let me bring it down. Go ahead and hyperextend back. Don't let me push it forward. Go ahead and flex up. Don't let me push it down. Okay, if you can go ahead and internally rotate. Don't let me bring it out. And externally for me. Don't let me push it down. Now abduct away from the body. Don't let me push it down. And adduct across the midline. Don't let me bring it out. Okay, perfect. Now I'm gonna go into range of motion of your elbows. So you're already extending them for me. So if you can just flex them up at a 90-degree angle, like you're doing a bicep curl, and then go ahead and supinate for me and pronate. Okay, so extend down normally. Okay, don't let me push them down. Go ahead and extend up, don't let me push it down. Okay, now go ahead and supinate, don't let me bring it in. Pronate, don't let me push it down. Okay, so extend normally, don't let me bring it up. Go ahead and flex, don't let me push it down. Supinate, don't let me push it in. And pronate, don't let me bring it up. Okay, so we're gonna go into the range of motion of your wrists. If you can just extend them normally for me, flex them down, hyperextend them up, radial deviation, and ulnar deviation. Okay, so I'm gonna do those with extension now. So if you can extend normally for me, and then don't let me push it down, flex down, don't let me bring them up. Go ahead and hyperextend, don't let me push it down. And then, yep, don't let me bring it out. And ulnarly deviate, don't let me push it in. Okay, extend normally for me. Don't let me push it down. Flex down, don't let me bring it up. Hyperextend, don't let me push it down. Okay, and then go ahead and radially deviate, don't let me bring it out. Ulnarly deviate, don't let me push it in. Okay, perfect. So now we're gonna go ahead and do the Phelan's test. So I'm gonna have you put the back sides of your hands together for 60 seconds. If at any time you have any pain, numbness, or tingling, just let me know, okay? Perfect, I'm gonna start now. Okay, did you have any numbness or tingling while you were doing that?
No.
Okay, and I'm gonna go ahead and do a Tinel's test. So I'm just gonna tap on your moving nerve here. Any numbness or tingling pain while I do that? Okay, so that's gonna be negative for carpal tunnel. So now I'm gonna do range of motion of your fingers. If you can just extend them normally, flex them down, hyperextend them up, abduct them away from the body, and then adduct them, kind of make a fist. Okay, extend normally for me. Don't let me bring them up. Go ahead and flex down. Don't let me bring them up. Hyperextend. Don't let me push them down. Go ahead and abduct them. Don't let me bring them forward. And then adduct them. Don't let me bring your fist out. Perfect. I'm going to go ahead and do that on the other side. So extend normally for me. Don't let me push them down. Flex down. Don't let me bring them up. Hyperextend up. Don't let me push them down. And then go ahead and abduct. Bring them in. And adduct. Don't let me pull them out. Okay, perfect. So you have active range of motion of your shoulders, elbows, wrists, and fingers, and your muscle strength is a 5 out of 5 in your shoulders, elbows, wrists, and fingers. Now I'm just gonna go and I'm gonna generally inspect your greater trochanter, your upper legs, your knees, lower legs, your ankles, feet, and your toes. So they look symmetrical. The color is even and pink throughout. I see no skin breakdown, no rashes or lesions, no masses, nodules, abnormalities at all. I'm gonna go ahead and palpate. Let me know if you have any pain or tenderness while I do this. Any pain or tenderness?
No.
Okay, and I feel no edema or masses while I do that. So next we're gonna go ahead and go into range of motion of your hips. So if you can just lay back for me. Okay, so you're already extending your hips normally here. So I'm gonna have you flex them up at a 90-degree angle for me. Perfect. I'm gonna externally rotate them towards me. Internally rotate. Okay, perfect. And now I'm gonna go ahead and have you abduct away and abduct across the midline of your body. Okay, and then for this one, same thing. So extension, go ahead and, other leg, sorry. Extend flexion, perfect. And then go ahead and internally rotate, externally rotate. Go ahead and do the abduction for me away from the body and adduction across the midline. Now I'm going to do these with resistance, so you're extending normally already, so don't let me bring it up. Okay, go ahead and flex 90 degrees, don't let me push it down. I'm going to go ahead and externally rotate it, don't let me bring it in, and internally rotate it, don't let me push it out. Okay, okay, go ahead and abduct, and then don't let me push it in, and adduct across the midline, don't let me bring it out. Then since I'm over here, I'm just gonna have you lay on your side, and I'm gonna do hyperextension. Have your leg back here for me, perfect, and then don't let me push it forward. Perfect. Okay, you can go ahead and lay normally. Okay, so same thing over here, extending normally. Don't let me bring it up. Go ahead and flex at a 90 degree, don't let me push it down. We're gonna externally rotate, don't let me bring it in. And internally rotate, don't let me bring it out. Okay, and then you're gonna go ahead and abduct away, don't let me push it in, and adduct across the midline, don't let me bring it out. Perfect, you can go ahead and lay on your side, and I'm gonna have you hyperextend, and don't let me push it forward, okay? Perfect. Okay, so now I'm gonna go into the straight leg test. So for this, I'm just gonna raise your leg until I feel resistance. I'm gonna flex your foot, okay? Let me know if you have any pain or tenderness. And then flex your foot. Any pain with that at all? No. Okay, go ahead. Flex your foot. Any pain with that at all?
No.
Okay, so that's negative for a herniated disc. So now I'm gonna go ahead and do the range of motion of your knees. So if you can just extend them normally like you are now, and then go ahead and one at a time, just flex them up at a 90-degree angle for me. Good. The other one? Good. Okay, so go ahead and do that again. And then just go ahead and push it down, don't let me. Okay, and then don't let me bring it up. Same thing here, go ahead and bring it up, don't let me push it down. Go ahead and down, don't let me bring it up. Perfect. Okay, so I'm gonna do 3 tests for your knees. The first one is called the bulge test. So I'm gonna stroke the medial side of your knee. I'm gonna put pressure on the lateral side, and I'm just looking for any excess fluid right here in the medial side, which I don't see any. Same thing here. Perfect, and I see no excess fluid there as well. So I'm gonna do the ballottement test. So I'm just gonna milk down your leg here. Okay, and I see no extra fluid here, and I'm gonna push on your patella, and I hear no clicking or anything. Okay, I see no extra fluid, and I feel no clicking or popping. So now we're gonna do the McMurray's test. So I'm gonna have you flex at a 90-degree angle here. And then I'm gonna have you externally rotate and flex your foot. Okay, and now I'm just gonna straighten your leg. Let me know if you have any pain or tenderness while we do this at all, okay? No? Okay. Go ahead on the other side, flex this up, externally rotate on your toe, okay, and straight. Any pain? Perfect. You can go ahead and sit up. Okay, so now I'm gonna go ahead and go into range of motion of your ankles. So you're already extending normally for me. If you can just dorsiflex up to the sky, plantar flex down. Okay, perfect. If you can go ahead and adduct inward for me and abduct away. And then go ahead and do inversion, which is going to be your big toe up towards the sky, and eversion, which is your pinky toe. Perfect. So I'm going to do all those with resistance as well, okay? So you are already extending normally, so don't push it down. Flex, dorsiflex up, don't push it down. Plantar flex down, don't bring it up. Go ahead and abduct away, don't bring it in, and adduct towards, don't bring it out. Okay, go ahead and do inversion, which is your big toe up, don't push it down, and eversion, don't push it down. Okay, extension, don't bring it up. Go ahead and dorsiflex, don't push it down. Plantar flex, don't bring it up. And then I'm going to have you abduct away, don't push it in. Adduct towards, don't bring it out. And then inversion, and eversion. Don't push it down. Perfect. So since I'm already down here, I'm going to do the range of motion of your toes. So you're already extending them normally. Don't push them down. And then go ahead and flex them down. Don't bring them up. Okay, perfect. So you have active range of motion in your hips, knees, ankles, and toes. And your muscle strength is a 5 out of 5 in your hips, knees, ankles, and toes. So now if you can just stand up for me, I'm going to go ahead and generally inspect your thoracic and lumbar spine. So I see that it is symmetrical. I see no curves. So I see no signs of scoliosis, lordosis, or kyphosis. The color is even throughout, and I see no edema or masses. So if you can just go ahead and bend down for me, I'm going to go ahead and palpate. Let me know if you have any pain or tenderness at all with this, okay? Any pain?
No.
Okay, perfect. So I didn't feel any edema or masses with that either. Okay, so you can face me. Okay, so you're already extending normally. So if you can just flex forward, hyperextend back, side to side. And then I'm going to stabilize your hips, so if you can just rotate the upper half of your body for me. Okay, perfect. You have active range of motion. So now I'm going to just go ahead and have you walk back and forth from the couch. I see that your gait is steady. I see that your cadence of stride is appropriate. You are able to bear weight moderately and evenly. Your toes are pointed forward, your posture is erect, and your arms swing in opposition. So I think that concludes our musculoskeletal exam today. Do you have any questions at all?